So in the first wave, I only worked one evening actually, because it was all quite a bit hectic, mainly due to we didn't know how to organize the healthcare around these people. And during the second wave, and that's the problem we're having now, is that a lot of the people in the healthcare themselves get ill, which is mainly caused by the COVID itself, and therefore we have too little. The amount of people who can help is way too low. The amount of beds we have on the ICU can't be used in total because there are not enough nurses to take care of the people. Those are the people you really need on the ICU. I just read something in an article that you can have an orchestra, and you need a director. So let's say that doctors are the directors, but the musicians are the nurses, and you can't play music without the musicians. This year alone in the Netherlands, we miss 900 melanoma cases at the moment, which is a severe type of skin cancer, a deadly type of skin cancer. We miss 900 cases at the moment. We don't know where they are. No, but it works two ways, like you say. It works just visually, that you the distance between people increases due to wearing masks, but works as well for droplets and coughing and spreading viral load. It's not working 100%, like you say, but it's working good enough that it works in public spaces. And as you say, when you used to travel in Asia, it's quite common there that they wear masks in public spaces. Yeah, but for me, it's normal to wear masks. So when I do my surgeries, I wear a mask, and I do surgeries for a whole day, and the whole day I wear a mask. And the difficult thing now is that a lot of people complain about asthma, and that's quite difficult because it's something to get used to. So it takes time to get used to a mask, but your health doesn't decrease. There's one similarity, I think, with the flu, and that is that it's transportable via aerosols, via the air.
It's airborne.
You can get it. It's airborne disease. That's it. That's the only comparison, I think, with the flu. But the replication numbers are much higher in COVID, and especially the inflammation you get from COVID, it's way more severe. So with a flu, and a flu is quite difficult because in the Netherlands we call it griep, and the griep is having a cough, having a nasal drip or whatsoever, and that's something we already call a flu. But when you see flu as the influenza virus, from the influenza virus you get a pneumonia, but with COVID you get a severe lung disease if you're very unlucky. I think the biggest risk of reckless behavior could be mutations. I think that's the biggest risk, because in every body, the virus itself behaves a bit different and evolves a bit different, because that's a normal thing for viruses to do. to evolve, to work perfectly, to survive perfectly in a body. And the difficult thing with reckless behavior, the spread of the disease will be much faster, and therefore you have more chances of evolvement of the virus itself. So having a new mutation, sort of like the situation now in England. And that's quite scary because we think, I think we have a good vaccine at the moment, but it could be that a mutation won't be sensitive for that vaccine. And if that is caused by reckless behavior, that's a problem actually where you're not responsible for other people or take other people into account. Chances are that your coffee bar at the corner will close down eventually because the government itself will lock down the economy itself. You can look at situations in other countries, for instance, New Zealand, where I think they did the COVID lockdown very well because they made the entire population responsible. And sharing that responsibility is the best thing I think you can do. Making everybody responsible. But the other thing with good leadership is also giving some people hope. And that's also a difficult thing.
Of course.
In New Zealand, they did it super well. They really did it super well. Because making it sort of a shared decision, sort of. So everybody felt responsible for the upcoming period of time. It also was very personal, what she did. And I can only applaud for that. You teach the DNA a trick for making your own antigens against the virus. And that's something which is crazy to think about. The trick itself is tried for cancer therapy in studies for the past 15 years, I think.
Even more. I studied in the 1990s, I believe, that kind of thing.
But they're trying to cure cancer with this trick. So decoding a very small part of your DNA, or making sure your DNA works for making antigens against something. And the first time this vaccine trick worked, I think it's with Ebola. So the Ebola vaccine works with the same trick as well. So that the vaccine which is injected is, like you say, sort of a password, which unlocks an extra trick in your body. And the trick, it's super smart. This, I think really this is one of the smartest thing in the medical area from the past, I don't know, 100 years. It's super smart. The Pfizer vaccine is tested on 30,000 people. And when you compare it to old vaccines, which we still use today, for instance, for the yellow fever, when you go travel, you need to get a yellow fever vaccine. That's only tested on 20,000 people ever, and it's already on the market for 40 years. We have experience with that trick for 15, 20 years because of its scientific use. So you definitely don't need to be afraid for the trick, because the trick we've tested on 50, 100,000 of people, which is already 20 years ago or 15 years ago. So I don't think you need to be afraid for the side effects at all, because the trick, the code is the only thing they changed. and not the trick of the vaccine. When you have an unlimited amount of vaccinations, then it's possible.